All right, let's just jump right in. Today, we're tackling something literally every single one of us has dealt with, yet honestly, very few of us actually know how to properly navigate. We're talking about pain. We're going to take the official guidelines from the CDC, the National Institutes of Health, and the Mayo Clinic, and synthesize all that complex medical jargon into a super clear, actionable guide. The goal for this explainer? Simple. We want to give you a real roadmap for decoding exactly what your body is trying to tell you, from those annoying everyday aches right up to knowing precisely when it's time to call a doctor.
I mean, we've all been there, right? You wake up with a stiff neck, or maybe you bend over to pick up a heavy box and you feel this sharp twinge in your lower back. Instantly, your brain just kind of spirals. You start wondering, okay, is this just a pulled muscle because I pushed it too hard at the gym, or did I actually do some serious damage here? It is such a relatable question, and honestly, it can be pretty scary when you just don't know the answer. But today, we're going to swap out that anxiety for solid knowledge. We're priming you with the official data so you know exactly what you're dealing with.
So here is our clinical roadmap for today. 1. Understanding muscle pain. 2. Assessing chronic pain. 3. The role of daily function. And 4. Knowing exactly when to see a doctor. Let's start right at the beginning with Section 1. Understanding muscle pain. Okay, the absolute first thing you need to know here is that muscle pain is completely universal. According to the Mayo Clinic, these acute aches are often just your body's short-term reaction to physical exertion, maybe a sudden spike in your stress levels, or a super minor injury. Maybe you tried a brand new workout, or you've just been carrying a ton of tension in your shoulders from staring at your laptop all day. These aches are incredibly common, and usually they're absolutely not a cause for immediate panic. Your body is basically just communicating that it got pushed past its normal baseline and it needs a minute to recover. So really, it's a feature, not a bug. But what happens when that pain just doesn't go away? That brings us to Section 2, assessing chronic pain. So the National Center for Biotechnology Information defines acute muscle pain as short-term, highly localized, and directly tied to something you recently did. It's your body's built-in alarm system working perfectly. You touch a hot stove, it hurts, you pull your hand away. Boom. But chronic pain, that is an entirely different beast. It's long-term, it's persistent, and wild enough, it's often totally disconnected from whatever the original injury was. Basically, that alarm system is malfunctioning. It's just ringing constantly, even though the initial danger is completely gone. And because of that malfunction, figuring it out requires a much more comprehensive clinical assessment.
When pain makes that jump from acute to chronic, official medical guidelines tell us we actually need to totally shift our mindset. You literally cannot assess chronic pain the same way you look at a sprained ankle. Assessing it requires looking way beyond just the immediate physical sensation of, ouch, this hurts. Why? Because persistent pain inevitably bleeds into every other corner of your life. It creates this vicious cycle. It ruins your sleep, which totally tanks your mood, which then drains your cognitive focus and your energy. To actually understand chronic pain, we have to look at the massive, cascading impact it has on a person's entire life.
And that huge shift perfectly sets up Section 3, the role of daily function. This is arguably the most important paradigm shift we are covering in this explainer. This is where it gets really fascinating. Both the CDC and the NCBI define function in a way that might surprise you. They don't define it as being completely pain-free. Not at all. Instead, function is defined as your ability to carry out everyday activities, maintain your mobility, and actually sustain your quality of life, even if some pain is still hanging around. This is a massive shift in how we look at health. It means medical success isn't always about forcing your pain level down to absolute zero, which, let's be real, is sometimes impossible. Instead, success is about how well you can actually live your life and do the things you love.
So how do we actually measure this in the real world? Well, you walk through a functional evaluation using 3 really specific steps. Step 1, identify your essential daily tasks. This could be anything: walking the dog, typing on your keyboard comfortably, or holding your grandkids. Step 2, objectively note exactly how the pain is interfering with those specific tasks. Are you having to stop after 5 minutes? Does lifting a certain weight make you wince? And then, Step 3, adjust your care strategies. Maybe that's physical therapy, pacing yourself, or taking medication with the specific goal of improving your ability to do those exact tasks. You're treating the function, not just the pain.
This whole idea is an absolute game changer for reframing your health metrics. Traditionally, patients get totally trapped in that classic 1 to 10 pain scale, constantly obsessing over, am I an 8 today? Am I a 7? But the new focus, which the CDC champions heavily, swaps that out for tracking tasks completed. The definition of success totally shifts from total pain elimination, which can unfortunately lead to overtreatment and a lot of frustration, to improve quality of life. Think about it. If your pain went from an 8 to a 6, but you can finally sleep through the night and cook dinner for your family, that is a massive, highly successful medical outcome.
But look, there are absolutely limits to doing this on your own. Let's move into our final section, Section 4, When to See a Doctor. Optimizing your daily function and managing your own minor aches is incredibly empowering stuff. It really is. However, knowing exactly when to stop self-managing and call in the pros, that is literally the most powerful tool in your entire health toolkit. The Mayo Clinic has very strict, incredibly clear guidelines for when a typical run-of-the-mill muscle ache might actually be a siren warning you of a severe underlying condition. We absolutely have to know when to escalate our care. So pay close attention to this rapid-fire checklist of Mayo Clinic red flags. You need to seek immediate medical care if your muscle pain comes with trouble breathing or unexpected dizziness. Watch out for sudden, extreme muscle weakness. Definitely be on high alert if the pain comes with a high fever and a stiff neck. That's a really well-known potential sign of meningitis. Look for visible signs of infection, like severe swelling or redness. Take note if the pain pops up right after a tick bite, which points towards Lyme disease, or right after starting a new medication. And lastly, if you've been responsibly trying self-care and rest, and literally nothing is improving, it is time to call a professional. No exceptions. If we took all of these official guidelines from the CDC, the NCBI, and the Mayo Clinic, and just boiled them down into one overarching philosophy, it would be this. Managing pain is about preserving your quality of life, and knowing when to ask for help is your strongest tool. The ultimate goal of all this data isn't just to inform you, it's to empower you. The medical consensus wants you to live fully, to adapt your daily tasks when you need to, and to stay highly vigilant for those critical red flags. Which leaves us with this one final thought for today. Take a step back and really ask yourself, when you are dealing with everyday aches and physical hurdles, are you just measuring your pain on a scale of 1 to 10? Or are you measuring your life, your function, and your daily joy? Because honestly, shifting that focus might just change absolutely everything about how you heal. Thanks so much for hanging out with me for this explainer. Stay curious, stay healthy, and we'll catch you next time.